everybody. Today we have another mental health seminar, and I'm really excited, especially for this one. My family does have a history of drug abuse and substance abuse, and that is going to be the topic of this mental health seminar. And so basically, we have brought in the best of the best, Dr. Arnold, and he's going to present to us everything he knows from substance abuse to all kinds of drug abuse. And really kind of just give us the insight that we kind of need to kind of develop the youth in our community and to better our own community. So Dr. Arnold, take it away. Thank you.
Okay, well, thank you, Dylan. That was you really went over the top on that introduction. I truly appreciate the kind words. Allow me to introduce myself a little bit more. My name is Dr. Bob Arnold. Most people know me as Dr. Bob. I'm a psychologist. I do private practice and I teach at the university as well. My private practices are in Largo and in Palm Harbor. I have two offices where I work with other professionals, prescribers, ARNPs, speech and language people, and so forth, to provide a comprehensive psychological and counseling services to children, adolescents, and adults, and geriatrics as well. In addition to that, I also have the privilege of operating and teaching as a professor at two universities through the university partnership at St. Pete College. One is the National University of Health Sciences. The other is the Barry University Physician Assistant Program. I have been doing this now since close to 30 years. I think my greatest achievement in becoming a psychologist was meeting my wife in graduate school. So we've been married for 27 years now. As part of our practice, we do spend quite a bit of time working with people with all different sorts of issues, substance use and abuse being one of the major things that many people sort of have to be challenged with, struggle with. But the good news is that with the work and with support, many people can find their way to a healthier and happier place. And you did send me a lovely list of questions, but I'd like to make this a bit more conversational. If you would like to, I would like to know what you would like to know. So please ask me some questions. Hopefully I can answer them. And if I can't answer the question, I will tell you I cannot answer that, and I will find somebody who can. So who'd like to start?
Yeah, I guess I'll just go ahead and kick off our first question here.
Hi, Maddie.
Hi.
Now, where do you go to school?
I go to school at Indian Rocks Christian School.
Oh, very good, very good. Well, welcome. Nice to meet you.
You as well. I guess it would be nice to hear your story or how you got to grow and experience more within your profession.
Oh, well, you know, it was interesting. I was a business person for years, and I became quite fortunate that life treated me well, and I had the opportunity to go to grad school. So I thought first I wanted to be an industrial organizational psychologist because it's sort of aligned with business. But as I became more familiar with the field, I actually leaned into working with kids. And a funny story that I hadn't thought about for a while, amusing, not necessarily funny, but my mother in the 1960s actually started a grassroots effort to help kids dealing with substance abuse. This is back when I was 7, 8, 9 years old. She died when I was quite young, but that was one of her legacies. And in fact, on Long Island, New York, in Suffolk County, it's one of the largest community-based sort of drug education, rehab types of programs that exist in the country. And I'm very proud to say that she got that started. But while I went to school, I never really thought much about that. I was thinking of other things. It just sort of wrapped back into my life that I realized that I do have a bit of a history in looking at this as a societal issue. I just wasn't really paying attention until I got a bit older. So, is that okay?
No, yeah, that was perfect. It's cool to see how you continued her legacy, and it's a very beneficial thing, especially in our society today.
Yeah, and completely unintentional. Things just kind of put you where you need to be. So.
Yeah, it was definitely your purpose.
Yeah. So, who's got another question?
Well, I have another question.
Okay.
So I go to CCC, which is in Clearwater.
Excellent. Yes.
And so basically, I've also, as I've kind of gone through high school, I've obviously been exposed to people who are, abuse drugs and that kind of thing.
Mhm.
And so my question is, like, when it comes to vaping and it comes to nicotine addiction,
Mm.
what is the average or general for how long it can take somebody from introduction to nicotine to being addicted and fully reliant on it?
That's an interesting question. Of all the substances that we might get to talk about today, nicotine is just really, 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 it gets its hooks in you.
Hmm.
And like with all addictions, there's the behavioral component. There's how it's supported by the people in your circle. But very insidious. Nicotine's a tough one. The actual addictive piece, where you're craving it each day, is going to be different for different people for different reasons. So I really can't say 1, 2, 3, 4, 5 uses and be accurate with that. What I can tell you though about vaping is it's probably the one substance that has increased in use uh, exponentially as compared to all other things like alcohol and marijuana. Those are the top three: alcohol, marijuana, and vaping. The youth risk assessment surveillance system, which is where I pulled a little bit of data from for our discussion today, indicated that in 2017, about 13% of students between 6th and 12th grade were vaping. And that's kind of the range that they use. As of the last surveillance data, it was 32, almost 38%. So we went from 13% to 38% of those youth reporting utilizing vaping. Under 20% use tobacco in different forms, smoking, cigarettes, cigars, or chewing tobacco. But vaping is just, it's just become, it's just blown up, and having vaping as a big issue, along with COVID, really has a lot of other public health concerns. So we're dealing with a virus which has many, many symptoms, but respiratory symptoms being one of them. And so anytime that you're inhaling anything that's going to damage your lungs, the two together are quite a deadly combination, or at least a dangerous combination. So I have real concerns for this, and managing the expansion of vaping is going to be difficult. It's going to require policy changes, but you can't legislate things. You can't always legislate behavior. We have to find other ways to get people to engage in healthier behaviors than that. So thanks. Great question, Dylan. Who wants to hit me with something else?
I guess a follow-up question to that would be, how would we, because I know a lot of people, and even some people in my friend group who have that habit of always just, I need a vape, I need a vape, I need a vape. How do we, I guess, get them out of that habit without, kind of imposing them like it's not good for you? Because I've realized that they don't really like to hear that. They know it's bad for them, but they continuously do it. So.
And this is something which is very important, and this links to actually our dialogues and the way that we're trying to treat people with addiction issues or substance use disorders differently. There are very, very few people who aren't informed, right? Which teaches us something, that being informed is important, but being informed isn't necessarily powerful enough to change behavior. It's not necessarily powerful enough. Anybody that I know who's smoking, teens and adults, they can tell you that it's not good for you. People who overeat, people who are carb addicts, right? People who spend too much time on their phone, people who drink too much. They can all tell you that, yeah, this isn't good for me. And yet it doesn't seem to be enough to stimulate them to move in a direction where they want to cease and desist and get the help to stop using those. We do know that one of the most important things for folks is encouragement and patience. Very often we get angry with people and we become disappointed. Why don't you just stop that? It's not good for you. I'm not going to talk to you if you keep doing this. You can't be my friend anymore. And it's actually the stripping of bonds away between people that usually allow people to lean into those addictions a bit more. You know, they fill a space in a person's experience. What we also find if you talk to people who smoke, right, or vape, nicotine has a very, very, very interesting way of engaging with your brain. For some people, they find it elevates them, right? It sparks them up. For other people, they find an anxiety reducing sort of feeling when they smoke. And so we do know that people with all forms of addictions, all forms of substance abuse disorders, very high correlation with other types of mental health issues, not necessarily things that will lead to a diagnosis. You know, there is quite a bit of depression and quite a bit of anxiety, I think, in all of us. It doesn't always move to a diagnosable or pathological place, but we're all under a lot of stress. And if you seek out something that helps to reduce that stress, it changes the way of being. That's a hard thing to really argue with folks. You know, how do we provide people comfort, feelings of safety, feelings of belonging, feelings of love in our daily lives so that they don't need that instead? And it's a tall order. Encouragement, you know that's not good for you. You know, I think most people do know that. Being in environments where, you know, and the insidious thing about vapes is people can get away with those in so many places.
Mm-hmm.
You know, you can hide them. It's unlike, you know, when people light up a cigarette and everybody kind of turns and like rolls their eyes and walks away from the person. With vaping, you know, they pull it out of their jacket, they, you know, take a hit, they put it back, right? And so the social stigma attached to that in public places is not as high because it can be hidden. So there isn't any one answer, and I'm not sure. I mean, you know, accessibility is a big piece, and you know, when people want something, they find a way to get it.
Yeah.
You know, in the 1920s, when we had prohibition, really didn't stop people from drinking. So again, it's about dedicating oneself to a healthier lifestyle, and then having the help to make that happen.
So would you also say that it's important to inform the people who are struggling with that addiction, however they're struggling with that addiction because it, I guess, numbs their pain, but is it important to inform them that there are other ways to escape from that pain rather than being addicted to?
Oh, certainly. And for those of you, I mean, all of you, I imagine, are in school, right? Or sort of in school the way it happens to exist in its form today. Is, you know, if somebody is really wanting to, and that's almost 90% of making things happen, you have to get to a place where you really want to stop. So the individual, the person, the patient is really the most important variable in the entire process. But guide them to trusted adults. It might be difficult for people sometimes to talk to their parents about things, but most schools will have student services professionals, guidance counselors, school social workers, and school psychologists, which will know the resources in the community, particularly the smaller community. It might include things that can help them at school. I know that some schools actually do groups to try to help people not use or for other issues that they're dealing with. They can be encouraged to see their primary care provider. Speaking with your doctor is a good first place. That could lead, if necessary, to a referral to someone such as myself or other community-based resources. You know, I'm not very comfortable with telling somebody who is under the age of 18 to, you know, call 211 and look for the services that are available there. I mean, I think that it is a possibility that people could self-advocate, but having a trusted adult involved in the process of trying to change those behaviors, I think is very, very important. It's very difficult to do something like that on your own.
Yeah.
Yeah. So, some more questions.
I was wondering if you could elaborate on why someone might turn to drugs initially. And this is Ingrid talking.
Oh, okay. Yes. Oh, thank you. Yes. So we've learned a lot, you know, and I'm going to go back. If we were to go back to the earlier part of the century, when people were having problems with substances, it was often felt that it was a flaw in character. This is a weak person. This is a person again, of flawed character. We've come to know that there's so many complexities that lean into becoming addicted really to anything. And it could be your phone, it could be video games, it could be carbs, it could be, again, tobacco, nicotine, marijuana, right? And you lean into it. Most people begin to self-medicate. There's kind of a dual process. First, you're sort of introduced to it. Now, interestingly enough, most people are introduced to substance use from their parents. It's really not from their peers. We take examples of the people who are closest to us. Dylan very early on, and had mentioned that in his own experience, right, that there were people in his life, as I imagine with most of us, who have dealt with substance use disorders, addictions of one form or another. So first, there's exposure, right? And the old myth was, everything starts with your friends at school. And it doesn't really always start there, right? We live in a world where information is coming to us from every angle. 24-hour news cycles, these phones, my gosh, what would we do without them, right? And so people are getting images, people are being influenced, people are being exposed. And then it's just really a matter of access. For the person who is engaging in substance use, let's say for social purposes, we hear about people being social drinkers, right? That's maybe an adult having a glass of wine with dinner, and that's it, not the whole bottle, right? What we find is when people are typically in pain, a lot of emotional pain, and we can frame it within the context of maybe it's a mental health issue, which I would say it would be. But in trying to cope with life's daily stressors, very often if someone self-medicates, at least in the moment, it takes them out of it. Now, ultimately, it doesn't work in anyone's favor. There isn't anybody who abuses any type of substance or overuses anything that performs well at school and work, who's able to maintain healthy relationships, and ultimately is able to maintain long-term good mental and physical health. So, a big part of it is, what have you been exposed to? What does your culture say? Is it okay? Do you know other people who deal with their pain and their sorrow and their challenges and their misfortunes by self-medicating, whatever that medication happens to be? And then do people early on find some relief in it? It always becomes maladaptive over time. But those are the things that draw people to it. And if we can find ways to ease each other's struggles, to ease each other's pain, we could really eliminate a lot of substance use and abuse because we're leaning on each other as opposed to leaning on things that are less healthy. So one is the self-medication model, the other is the exposure and access model. Both of those sort of come together to set the stage for utilization in that method, overutilization. So does that make sense?
Yeah.
Yes, thank you.
Okay, you're welcome. Some more questions.
I know how, I know how you mentioned earlier that signs of substance abuse they're derived from signs of pain throughout someone's life, but what other signals, I guess, do we get from substance abuse? So like, what are some of the signs of substance abuse that we can visually see from a person?
Undoubtedly. So first and foremost, most people who are abusing substances are not going to come up and tell you, right? So they usually do it in secret until it can't be a secret anymore. This is a little bit, obtuse as an answer, but really a change in behavior. That change in behavior can be something like hygiene. It can be something like, you were always on time before and now you're always late. For students, it could be a lot of absences. We can begin to see, things along, so now you're missing work and you're missing school because you're not in any shape to truly engage. Changes in grades for college and high school and middle school kids is a big one. Not everybody's an A student, but even if you're a C student and you start making D's and F's, there's a problem, right? And we have to kind of sort out what's going on. You'll see changes in interactional styles. So for a lot of people, they become a little bit more reclusive and a little more isolated. This COVID has been a real challenge, because we're living in a world which is expecting us to be a little bit more isolated and a little detached from one another, which can lead to deeper bonds with whatever your addiction or substance happens to be. But again, hygiene, overall physical appearance, weight gain, weight loss, sleeplessness, not showing up, interacting in different ways. These are usually the first cues where we would ask in general, hey, what's going on? We would just reach out to our friends and family and say, hey, you seem a little bit off. Do you want to talk about it? And they may be honest or they may not be. For my residents and my advanced medical students, one of the classes I teach is doctor-patient relationship. And I begin the course by reminding them that all of your patients can tell you the truth, tell you a lie, tell you their truth, tell you what you want to hear, or tell you nothing at all. And we all have the right and privilege to disclose as much as we want. So people coming up and being really forthcoming about substance abuse issues might take some time. Sadly, people usually get themselves into a situation where there are many things to be sort of attacked at the same time simultaneously. And we usually see that crisis occur. Some people talk about people going to rock bottom. It's nice to try to prevent that, but often those are really the signs and symptoms. And of course, for people really struggling, we see correlations with self-harm, with other types of risky behavior, like texting while driving, drinking while driving. That puts many other people at risk too. And those are pretty telltale signs that we have a problem here. So was that fairly clear?
Oh yeah.
Okay.
Thank you.
You're welcome. So some other questions. Everyone's so quiet.
You guys are more than welcome to post any questions in the chat too, just to remind you. We can read them off. And
Can I ask a question? This is Commissioner Peters.
Oh yes, most definitely. Hello, Commissioner Peters. How are you today?
I'm good. So what I would say is, if a student has a parent or another relative that I'm really thinking parents, right? Because most kids end up in foster care because of their parents having a mental health or an addiction issue. So for a student, what are some things that they could do either to help their parents realize there's a problem or get them help, and then I guess the second question is what can they do to help themselves? Yeah,
and that's a great question, and it's tremendously complex. So many youth, and actually, when people grow up and become adults and they have parents who have had substance use issues, something which can occur is very often the young person becomes parentified. Their parents have such difficulty functioning that you find that teenagers in many ways are kind of running the household, and having to take care of their siblings as well as taking care of themselves. I think from the standpoint of taking care of oneself, I'll go back to find those trusted adults in your life who can help you first, and then maybe help you help your parents. It's very, very difficult for a child, a daughter or a son, to try to guide their parents to get healthy, and that's when you're young or even when you're older. Again, they know that smoking is bad for them. They have COPD, but they continue to do it. And it's a really hard thing to do. I would really lean into, if those are problems that are plaguing you or your friends, again, first seek out a trusted adult. Usually somebody at school would probably be the first place to start, talking about it and problem solving. Getting help for your parents can be very difficult. I think, Commissioner Peters was alluding to the fact that sometimes it takes a crisis, right, for people to know what's going on, and then to be able to intervene. A domestic violence situation, a neglect situation, something that requires first responders or law enforcement to come out and sort of deal with what's happening. And so I would sort of lean towards making sure that we can find resources first for the student, first for the youth, and then perhaps with the help of trusted adults, we might be able to intervene and assist the parents. As adults, everybody has autonomy. They can choose to go into treatment. They can choose to get help. They can choose not to. It's very, very hard to force somebody to do that. Again, because of these issues, a lot of people do end up in foster care. Sometimes they end up living with relatives who love them and can take care of them. I've known a lot of young folks who essentially sort of live on their own and sort of kind of maintain their parents, which is very, very, very difficult as well. An absolutely wonderful question with no real simple, definite answers. Again, there's a lot of complexity to that, but thank you for asking that question, because some questions aren't easily answered, but things really, really need to be thought about. And if we take the time to think, sometimes we can find solutions, because I think one solution for maybe one family might be different than a solution for another family. So, is that an okay response?
That was great. Thank you.
You're welcome.
We have someone from the chat, Hayden, who said, do you think schools should enforce rules against drug use at school, or do you think it makes the abuse situation worse?
And I wanted to piggyback off of that question just with a certain element of like, what element does shame play into the addiction process and that kind of thing? And also just kind of that element is what Hayden was talking about, kind of really kind of sparked me to think about that, is like, because sometimes it feels like schools can definitely shame the student into even making it worse, it seems like.
Yeah, and this is a really, really big question. For many years, we sort of took a scorched earth policy towards people dealing with substance abuse issues. And if you take a look at, a punishment model versus a treatment model, they're very, very, very different, and they require different types of resources and really a different sort of approach. I think that if people are using substances on school grounds, that is inappropriate. And let's remember that there are some substances like alcohol and so forth where there's age limits, so it is actually illegal, right? But the shame and the punishment model, and really the isolation model, which is part of that, doesn't really support a health and wellness model, and so they sort of operate in parallel in most cases, right? They're not necessarily operating very well in a blended model. Having substances using on campus is really got to be a no-no. But I also think that maybe instead of reassignment in some cases, which is usually what ends up happening for most students, or suspension, those types of things, it has to be coupled with, are we going to put you in front of people who can help you? And again, schools have a lot on their plates. They're being asked to do so much more these days than they've ever been asked to do before, particularly from a health and wellness standpoint and from a mental health model. A lot of factors have driven us to begin thinking about that more. But schools are also the communities where people gather. It just makes sense. A number of years ago, there was an initiative called Full Service Schools. And here in Pinellas County, we had a couple of high schools where we actually had medical clinics. I had an office in one of them, and I was there a couple of days a week, and a physician was there a couple of days a week, and a social worker was there a couple of days during the week. And we could very, very effectively reach out to the youth in that particular school community. I think those types of directional things can be very, very helpful. Again, one of the first questions was, do people know it's not good for them? Yeah. Are they typically ashamed when it becomes a problem? Certainly, we all do, right? Are they shamed? Oh, undoubtedly, yeah. We shake our heads and we point our fingers, and that's something we all need to begin to we need to begin to look at taking another path. Acceptance, encouragement. We're not going to give up on you. If you slip and fall, we're not going to shame you. We're going to do our best to try to help you get healthy and well. But there's a lot of complexity here, you know, getting the providers, getting the services, and getting people to think in that sort of model, which is really different than where we've been. In the 80s and 90s, it was say no to everything, which doesn't work, it's insufficient, and let's throw you in jail because that way you can access drugs, but the reality is you can. and it doesn't really help towards that healing process. So trying to reduce anything that would make somebody feel ashamed, I think, is important. And if we can look at a model of care versus a model of punishment, I think that we might gain some ground. So I hope that I was able to kind of get both of those questions in.
Yeah, and actually adding on to that, I went to a public school previously in Tennessee, and once a month they would have a police officer and the drug dogs walk around the school. And as soon as the drug dog either sniffed something out of a student's pocket, backpack, locker, etc., disciplinary actions were enforced. So do you think that it's fair to just automatically have the disciplinary actions for the student, or rather a counseling effect should take place, but would the student actually take it seriously?
Yeah, and I think every situation is going to be different, you know. And again, you know, our schools are microcosms of our community in essence, and you know, and there is difference between, and we need to keep this in mind too. There's difference between use and abuse, and there's also difference between having something in your possession and selling something, right? And, you know, of course, if people have substances that they shouldn't have on campus, they're typically getting it from someplace, and very often it's another student. And so again, everything needs to sort of be investigated. But I would say that, you know, again, that's a hard one because, you know, there's a public safety aspect to this, right? And keeping everybody safe, I think, is very, very important. But the other aspect is treatment. And, you know, people are trying to make efforts to blend the two. You know, I was in conversations with a few of our police chiefs in the area, looking to create some blended models by perhaps having mental health providers ride along with their officers. And it sounds good by saying it out loud, but it's different. You know, the type of relationship that I'm compelled to have with a patient is one that is supportive and based in confidentiality and based in health and safety, first and foremost. Law enforcement sometimes has to take a very, very different approach, you know, and it would be great to see if we could really come up with a blended model like that. I'm not sure if it'll be able to occur, where we're saying, yeah, you know, legally you can't do this, but we're going to get you the treatment you need. That would be sort of the perfect world. I'm not sure if you've had the opportunity to speak with any people in law enforcement, but there's something it's not just Pinellas County, it's nationwide. Our largest mental health receiving centers in the country are our county jails. And you know, it's not our hospitals. Since deinstitutionalization, there are fewer and fewer places where people can get care. And community mental health services are overwhelmed, and unless you have good insurance, you can't access high quality private care. So there are a lot of gaps. I think most people are sort of aware of them. You know, I'm a fan of treatment. That would make sense versus punishment. But I understand that there has to be a balance of both. So I don't know that there's one right answer. And we have that here too in Pinellas County. You know, we have school resource officers, many of whom do just an absolutely amazing job in integrating into the school community. But yeah, you know, there are those, you know, they call them dog days. They're days when the dogs come to campus and they smell something in someone's trunk, and now they open up the car, and now we've got all other kinds of issues occurring for that student. So, yeah.
Thank you.
Great question, though.
Yeah.
Great question.
So one thing that kind of just struck my mind when you were discussing that is the element of if there is no punishment, is how do we make sure that people want to stop? And if they don't want to stop, then what would be the proper course of action? Because it's bad for them, it's bad for the community. And especially if they're spreading it, if they're saying, hey, you try this, or even worse, they're selling it, and engaging more people in their malbehavior, then it seems like that seems like a sticky situation. So what do you kind of suggest for in a situation like that?
Well, what I'm going to do is, and again, that's different. If somebody is selling intent, that's a very different sort of crime than somebody who's dealing with an addiction, right? So, I think that there have to be some parameters regarding that. And keep in mind too that many people who sell drugs don't use drugs, right? So there's another element. Bartenders don't drink, and people who are selling weed aren't using it because it breaks into their profits. So you're looking sometimes at a very different person. Not all the time. There's undoubtedly an overlap there as well. But I want to talk a little bit about, and this is just basic psychology 101. Anybody, and I'm sure you've all taken psych classes or will, you'll hear about things like positive reinforcement, punishment, negative reinforcement. These are very, very basic psychological principles. There's something that we know though. Punishment can stop a behavior in the moment, but it doesn't teach anybody anything. We learn, quite frankly, when we see a benefit in doing something a different way, right? So if we want to create pro-social behavior in people, whatever that behavior might be, it's usually a matter of teaching, reinforcing, and making the healthy behavior more meaningful than the unhealthy behavior, right? And so punishment stops behavior in its tracks. It really doesn't teach new behavior. And so when we're treating people with substance abuse disorders, with other forms of addiction, the first thing we always have to identify is a replacement behavior. If you're not going to do this, what are you going to do instead of it, right? Because we learned that just saying no doesn't work. You can't just stop things. So if you're not going to be attached to your phone 24 hours a day, what will you be attached to? What will you bond to? If you're not going to smoke that cigarette with your cup of coffee every morning, what will you have in replacement of that? If you're not going to smoke weed, if you're smoking weed for anxiety reduction, what kind of skills can we teach you to either change your circumstances and or develop some skills to manage your stress that don't require a substance? So, and that's something that you work with a person. There's not one size fits all. So everything has to be very, very individualized and very tailored to their needs. So what's the replacement behavior that works for you? That's a big piece of it. So, there are certain, when people are committing crimes, we have rules, and those rules are pretty understood. There are very, very few people who say, oh, I didn't know selling drugs was bad or illegal. Yeah, you never hear anybody say that, So those kinds of folks know what they're sort of getting into. So again, very, very big, complex societal kinds of situations that, my hope is that you as the young folks will be able to do a better job than we did in trying to solve these problems. I'm 59 years old. I've had 35 years to try to figure some of this out, and I still scratch my head. So, this does become, in some ways, your opportunity to maybe change things for the better. So. Any more questions?
I have a question for you, Dr. Bob. Oh,
Certainly.
Arnold.
Oh yeah, go ahead.
Okay, this is Ashley. I was wondering if you could provide, I guess this might be more your opinion, but obviously based on your experience, do you deal with individuals who have gone through detox? And if so, what do you perceive as any barriers to voluntary versus involuntary detox?
Yeah, that's very, very tough. There are some people who are so deep in their addiction that I actually tell them, don't try to stop this on your own. You need to be medically supervised. I've had folks who, have been, alcoholics for decades, beginning to show symptoms of liver disease and that type of stuff. And they're like, my spouse just left me. I lost my job. I've got to stop drinking. I'm going to stop. And I'm like, yeah, I want you to stop. But if you just stop, you could put yourself at risk. People detoxing from opioids, people detoxing from other types of substances can put themselves at great danger of kidney failure, liver failure, heart attacks, all of these things. And so it probably at least once a month, I'm strongly encouraging somebody to do an inpatient stay. Let's do this the right way. Let's get you in a hospital or a medical facility. Let's get you hydrated on IVs. Let's get you, maybe in some cases, even sedated for a few days to kind of get through the withdrawals. And then let's work very diligently on an inpatient sort of model, intensive outpatient, and then back to an outpatient sort of care plan, perhaps with somebody like myself, or other kinds of things that people can do too. I'm sure many people, you've all heard about the Baker Act. Its companion piece of legislation is the Marchment Act, which if somebody is really, really, really toxic, that they can be hospitalized, involuntary, to get through that detox process and to find some stabilization. It's always better if somebody wants to do it. That's, I really want to stop. I need help. Great. We're well on our way. Typically, if somebody's forced to do it, the outcomes are typically less positive. They don't feel that they should be there. They feel that their liberty has been taken away, that their rights have been taken away, and usually their sobriety doesn't last very long if they've been forced to go into an inpatient facility. But that doesn't mean that we shouldn't do that. If you're being forced, that means you need hospitalization, you need stabilization, you need to be watched, you need to be in a safe place. And so the benefits of an involuntary, at least, is to keep people safe, at least until that storm passes, so they can maybe get the help that they need, or come to the conclusion at some point that they do need help and will seek it out on their own. Is that close?
Oh yeah, definitely.
Okay.
I guess I'd add a follow-up to that one. And we have discussed the Marchment Act with the kids because Commissioner Peters was pretty integral as a state representative in reforming the Marchment Act so that it was a little bit better aligned with the Baker Act.
Yes.
So in your experience, I guess, since you did bring up Marchment Act, do people tend to initiate a Marchment Act for a particular addiction? Is there something that's more common than anything else?
I
guess I'm getting at alcohol versus opioids.
Yeah, and this is interesting. Typically, when a Marchment Act is taking place, it's because the individual's behavior has gained someone's attention, and very often people who are using opioids, their behaviors tend to be a little bit more subdued. So, we're generally looking at an overdose that's occurring under those circumstances, or somebody, and we've seen this, somebody found, slumped over in the wheel of their car, right, with a child in the back seat. We see these things, sadly, far too much. Alcohol, quite frankly, tends to get people pretty riled up. They can actually, get into a psychosis if they have, alcohol toxicity, and that really gets people's attention. They tend to do things that are less socially appropriate, sometimes borderlining on criminal, sometimes borderlining on violent. And, in my experience, when that's happening, it tends to be brought to one's attention because of something along those lines. Much rarer are people in a family doing what I would refer to as an intervention, and trying to make that happen, because that's very hard to do. It's very awkward in essence. So, situations where first responders and law enforcement tend to be called are opportunities to have somebody perhaps become part of a higher level of care through that avenue. And this is something which is very important. And let me once again thank Commissioner Peters, because I try to keep up as much as I can with what's going on in Tallahassee and elsewhere regarding these types of efforts, legislative efforts that can trickle down into helping people. But whether somebody is involuntary or voluntarily placed through the Baker Act or Marchman Act, I'm always very clear to tell people when I have to actually invoke that this isn't about punishing you. This is about getting you some help. The reason that we're doing this is because we care. The reason that we're doing this is because we love you. The reason that we're maybe, temporarily taking away your liberty is because we want the storm to pass. And if you want to be angry with me right now, it's fine, but you'll be alive to be angry at me on Monday, and we can talk about it then. And again, there's this balance of how do we present or promote these as opportunities as opposed to punishments, and how do we let people know that this is available because we want to keep you healthy and safe, and we want you to get the care because we care. And sometimes the individual doesn't quite see it that way, but eventually, hopefully they do. Hopefully they do.
Thank you. That was a really good overview. We don't really hear, in our experience going to system meetings in Pinellas County, we don't usually get that granular. So that's pretty helpful. Thank you.
You're very welcome. You're very welcome.
I had a question really quick.
Sure.
So I used to live in Colorado where weed was legalized for recreational and medical. So moving here was definitely a big culture shock because I was so used to it being normalized. And I think there was supposed to be a vote about legalizing it recreationally here in Florida, maybe earlier in 2020, and now it's moved back. And so at that time, I think a lot of us will be able to vote because I'm close to being 18 myself. And I was just wondering, what would the effects of legalizing weed for recreational use be on the youth, and how would that just change everything socially?
Well, there are a couple of things to think about, and there's big picture stuff, which is more science-based, and then there's what people live every day, right? So, one of the benefits and the challenges, and I'll start with medical marijuana, is that if it's actually used medicinally, like it's prescribed, and it's not abused, it's not overused, and it's used for what it needs to be used for, such as seizure disorders, even some people who are dealing with, generalized anxiety disorders and panic attacks, it's being prescribed for many things as an option or alternate to traditional prescription drugs. But they have to be used wisely. You can't use your medical marijuana and drive your car. You just can't do that, right? And we expect those things. It's really hard to know about how many people really chose not to engage in the utilization of marijuana because it was illegal, right? Generally in our population, right, we can usually look at substance use issues across the board. Somewhere, you'll see numbers depending upon the substance between 0.03% and 20% of the population having problems with something at all times. Legislating people's behavior is hard, right? I suspect that the folks who are currently using marijuana recreationally will just continue to do so. I'm not sure that they'll get a lot of new customers. And what I mean by customers is somebody, because it's legal, might try it, but might decide that, this really isn't for me. I never did it before. I don't need to do it again, right? It could take some burden off of our legal system, right? Because a lot of people do end up in jail. There's a lot of money placed on that, and that money might be better spent on treatment and prevention, saying, hey, why would you want to do this anyway? That could be part of the discussion. But there's a lot more to study really about what's really happening relative to those places where it's legalized and where it's not legalized. And keep in mind too, there's differential enforcement. So, I think that we know that law enforcement is overwhelmed in many ways. And, there are municipalities that are writing tickets or just ignoring the fact that people are using marijuana these days. So I'm not sure that we're not there functionally already. I have seen the benefits of using marijuana from a medical standpoint. I retired in 2014. I had spent 20 years helping to lead our local hospice here, which is a magnificent organization, a very progressive organization. And the tools that we had in our pharmacy, in many cases, were sort of limited. But there was a substance called Marinol. It was a derivative, and it really helped people with pain reduction, anti-inflammatory reduction, and nausea, particularly cancer patients. And so I've actually seen it when it's used clinically, used correctly. But just like anything else, it can be abused, right? And that's where we have to be careful that we don't cross that line. The medical management of people utilizing a substance like that, I don't have much problems with, but it has to be medically managed. Just as you were getting, because you would be getting a prescription from your physician. The wide scale use of it, I don't know that helps anybody anyway, ultimately. I don't know that it moves, the needle forward in productivity or overall health. And I'm kind of a stickler for health and wellness. So I always ask myself the question, particularly when I'm sort of challenged with the pizza or the donut, if I eat this, is this working in service of my health and wellness? And if the answer is no, I try to take a step back. And we have to see what happens. We have to see what happens. So, I'm not sure if I answered that clearly, but Dylan, go ahead.
Sorry to interrupt.
No.
But so one thing that I've kind of researched a little bit, and one thing that I've heard and seen is that, so in Portugal, they had one of the worst drug abuses and substance abuses in the history of the world. And they continue to dedicate money into the punishment and crime enforcement, or police enforcement, and the legal enforcement of restricting people from using. And what they saw is that it entirely failed. And so they decided to take a completely alternate track, and they legalized everything, and they dedicated every dollar that they had been dedicating to crime enforcement, to preventing it using the law enforcement. They rededicated it to education and to treatment and rehabilitation, and they saw significant reduce in drug abuse. And so I'm kind of curious to, what would the effect of that be in our society today? Obviously, we haven't reached the level that Portugal was at, but would it be something that would benefit us? I mean, obviously, this is a question that can't necessarily be answered, but you can be analyzed. So what are your thoughts on that?
Well, first of all, you're very well informed, Dylan. So thank you very much for researching that. That is actually an amazing experiment that they're doing in Portugal right now. It's a small country, and it isn't a very wealthy country. They've been in an economic crisis now for decades, and haven't been able to pull out of the tailspin. And yet they completely rededicated their resources to education and treatment, and have seen remarkable results with regards to reduction in all of those things, health issues and so forth, that accompany addictions, particularly substance use disorders, if you will. And keep in mind, their approach was very multimodal. I really appreciate it. There was not only education about substances, but it was actually getting people education, putting them in school and paying for their school. It was also about affordable housing. So people had places to live that were safe and clean in order to get healthy, and access to healthcare. So all of these things were happening simultaneously. Again, a much smaller country than ours, but a country without a lot of resources. It'll be interesting to see, what occurs there, over the 10-year span. For any of the other students and adults who are on this, there's some pretty good TED Talks regarding this. And they really, they actually extrapolated from something that I was speaking about earlier today. One of the first things I was talking about is that as humans, we always bond to something, right? And for some people, they end up bonding to that substance. Their model was very much about how do we bond to things? How do we create social relationships? You know, it's interesting. Over the last 10 years, you know, our houses have exponentially grown in square footage, and our number of friends has decreased. You know, people knowing their neighbors anymore is something which is sometimes very, very rare. I don't want to deal with my neighbors because I don't have problems with them. That's what a lot of people will say. Our sense of community in some cases has been sort of kind of distance, and COVID doesn't make it any better, right? So you know, it's a grand experiment. I see potential in it, but there are a lot of other factors involved. You know, you're talking about really pivoting the healthcare system. You're looking at really making a pivot on how we deal with things from a legal, legislative, and law enforcement standpoint. And you're talking about a country which is being asked to very, very quickly, if you will, go away from that model of shame and punishment to encouragement and treatment. And trying to find that type of universal philosophical bent, I think might be hard for us in the United States today. But I don't know that it would be impossible in the future, right? A lot of moving parts there, but well done, Dylan. I'm keeping my eye on what's going on in Portugal on a regular basis. I became familiar with it actually watching a TED Talk a few years back. And I'm like, wow, what are they doing? And so I keep things about that on my news feed, just to kind of get a sense of, is it really working? What tweaks are they making? And could we maybe even try to do that on a small scale? I mean, you know, could we do something like that in a city, or could we do something like that in a county? I don't know. I don't know, but a lot of work would have to be done. But anyway, and I encourage everybody else to please look at that study too. It's very interesting. So.
When you
Any more
mentioned,
questions?
Thank you.
Sorry, I just wanted to say, when you mentioned TED Talks, I actually had to watch one from one of my college classes by Stephen Dunier. And he was talking about his social relations with himself and the community. And he was upgraded to or not upgraded, he was promoted to CEO of one of his best working companies out there for his field. He had the best of the best people surrounding him, but he was never satisfied within himself. And that led him to other problems. So he quit everything, and he saw where he was wasting his time. And it got to the point where he even tore out his car radio, and he would replace it with counseling sessions, and just even he learned how to speak a language by listening to those radio or little CDs, not even the radio station. Yeah. And he was able to learn German, and he grew confident within himself. And after growing confident within himself, he created a list of goals and was able to obtain those goals by taking one step. And he said, the biggest decision I've ever had to make in my life, leading me to where I am now, is taking that extra step and walking that extra mile of making myself realize where my problems are. So it's funny how it can relate to the substance abuse issue of people realizing why they're doing it and what's the purpose and what they're going to gain from it.
Yeah, and that's a very interesting story, and it really again, it talks about pivoting, about beginning to look at things differently, about adopting, you know, and really sometimes it's not adopting a new set of values, but it's actually living the values you have, right? And trying to find the value in ourselves. And you know, I was talking about people dealing with pain, and you know, there's always physical pain, of course, right? But the emotional pain, the relationship pain, the spiritual pain, all of these things that people struggle with from time to time, and sometimes substances will help to ease that pain or mask that pain, right? As opposed to turning around and dealing with that pain. Sometimes the rare person can really do it on their own, but that's really, if I were to encapsulize what I try to do every day, is I try to walk with people. I try to encourage them, teach them, let them know that they're not alone. Sometimes that's enough to get them to that next place, that next step, to live in a world of hope and possibilities versus one of fear and failure, right? And that doesn't mean we don't screw up sometimes. I think the best lessons we learn is when we fail. You know, remember what fail is: first attempt in learning. So it's not something to be afraid of. You're not supposed to be good at snowboarding. I just took up paddleboarding. It was hysterical. You know, and definitely, undoubtedly a fail. But I think that, you know, by the end of the summer, I'll be okay. I'll be good at it. So, and I would encourage everybody who's part of this group to not ever let that hinder you. Take the next step. If you don't know something, go learn something about it. It's okay not to know. It's okay to be the dumbest person in the room, because if you hang around the room sometimes, then you'll get a little bit smarter. And that can also help you feel a little bit better about life and yourself. So, yeah. Any other questions? This has been lovely so far.
Does anyone have more questions that they would like to ask in the chat? I guess I'll just mention this from the list of questions as well, as we didn't really target this discussion, but what's your intel from peer pressure? Because I've seen it a lot, and I've asked a lot of people why they're stuck on this certain addiction, from whether vaping, smoking weed, or whatever, and they say it's because, oh, so-and-so said it was cool, and they told me to try it, and I'm just hooked on it. So what advice can we give to them, and I guess how can we convince them that it's cool to not be cool?
Well, you know, that's difficult, and it happens in so many different ways, right? And there's, you know, you're providing the scenario where, hey, you ought to try this, it's great, right? And don't we do that all the time? Hey, you should go to see my friend Susan. She does a really good job on my hair, right? Or see my mechanic, right? It's almost like making a referral. I think it's not so much about the introduction that I'm concerned. What I'm concerned with is the social landscape. So let me give you a very, very, very real example. So I'm fortunate. I am blessed with many, many friends, people that I dearly love and I believe dearly love me. I'm a very social person. I'm always doing something. So COVID has really been painful. But I will have to say that, you know, as an adult group, it's rare that you go to someone's house for dinner and someone's not having a beer or a cocktail, right? So about a year ago, my wife and I had made a decision that we were going to get as healthy as possible and we were going to lose weight. Well, you know, even if it's a light beer, it's 90 calories. I don't need it, right? So do I keep myself out of that situation, or do I inform people that, listen, I'll be happy to come to the barbecue, but please don't offer me any alcohol because I'm trying to lose some weight, trying to get in shape, right? And that's about not so much teaching people to just say no, but teaching people to be able to kind of, you know, speak for themselves if it's something that's important to them. We are all pressured into all sorts of stuff. We don't need our peers to do it. You know, our social media can do it for us, right? We have a world of people telling us that we should dress a certain way and eat a certain thing. And you should like this song and don't like that song, right? Or vote a certain way. And it's, you know, there's a lot of pressure on people all of the time. We're all going to be introduced to stuff. Whether we explore it or not, that's a very, very, very individual type of thing. Some people feel very strongly about stuff and like, hey, no way, thanks for the offer, but I'm not really interested, you know. And then there's also that balance of how do we remain friends with people who engage in behaviors that we don't necessarily want to. And that's another level of this. So yeah, you know, we want to fit in. Everybody wants to fit in. Everybody wants to be part of some tribe. Everybody, you know, wants to be able to be part of things. Nobody wants to be known as a, you know, wow, you're really bringing me down. You're no fun. right? And yeah, and actually, I heard this the other day. There was a woman that I've been working with who's been sober now for 2 years. Absolutely amazing woman. She's working very hard on her sobriety. And her friends, for the most part, have been respecting it. But she went to a gathering, and one of her friends actually came up and said, you know, I really, really miss my drinking buddy. I miss the drunk you. It's like, oh, God. Did you think about what you were saying? And then I asked her, was she drinking when she said it? And she said yes. And I'm like, okay, there, right? And that type of pressure too, which is very, very like, oh my God, you really said that out loud to somebody who's trying to be sober? Oh man, that's just kind of rough. You know, I'm sure the person didn't mean any harm, but it can be very harmful. Words can hurt. So yeah, you know, picking your social groups or being able to say, listen, you're still my friend, but I really don't want to do that. That's kind of the skill set. It's a hard one to develop, but it can be developed. It's just tough.
Thank you.
You're welcome.
So it's already 10 after 4. I want to be respectful of your time. I know we're having a really good conversation, so I really thank you all. Did anyone have any final things you want to say, or Dr. Arnold, do you have any final words?
Certainly, if you don't mind. First of all, this has been a real pleasure. I was looking forward to it all week, so I'm glad and I'm very, very pleased and happy that you invited me. I'd be happy to come back anytime if I can be useful for something. For all of you who are dedicating your time to this, you know, I admire that. There are many things that you could be doing. There are many things you could be doing on a Saturday, but what you're trying to do today is you're trying to do something. One thing that might be able to make the community a little bit better. And, you know, typically, really the big successes in our lives are usually that one kind act, right? It's not the big thing, right? It's that little thing. And what you've all done today is you've taken time out of your day, you could be doing something else, to create something which hopefully will maybe help someone else. And I think that that's really one of the greatest gifts that we can give. If we get up every day saying, you know, I'm going to try to do something nice, I'm going to help somebody, we've already won. There's really nothing else to kind of fight about. So thanks for having me. If I can do something else with you in the future, please don't hesitate to call. And I appreciate your invitation once again.
Yeah, thank you so much for speaking.
You're welcome.
Yes, thank you again.
Okay, Dylan, enjoy San Francisco, dude.
Thanks, everyone. Thanks, Dr. Arnold.
Oh, you're very welcome. You're very welcome. Everybody have a great day.
You as well.
You too. Thank you so much.
Thank you so
Bye.
much.